Well, meanwhile, Germany's outgoing Chancellor Angela Merkel has warned that the country's current coronavirus measures are not enough. In a meeting with leaders of her conservative CDU party, she described the situation as highly dramatic, with new infections doubling every 12 days. Health Minister Jens Spahn has urged more Germans to get vaccinated with this blunt warning.
Most likely, when the winter is over, everyone here in Germany, and this has occasionally been said with some cynicism, will be either vaccinated, recovered, or dead. But that's the actual reality.
Not mincing his words, the German health minister there speaking moments ago. Well, to help guide us through the COVID-19 crisis in Germany and Europe at large, we're now joined by Hendrik Streeck, a professor and director of the Institute of Virology at the University of Bonn. Professor, a very warm welcome to DW News. Things are just not looking good across Europe, but I want to start our conversation by focusing on Germany first. Do you share Mr. Spahn's assessment of the situation?
Well, good afternoon. A pleasure to be with you. Well, I agree that the situation is serious right now. We have the highest numbers of COVID-19 cases in Germany than we ever had during the pandemic. And at the same time, we had eased some of the restriction and measures we had in place. So we have the warnings from the intensive care physicians, and this is something we have to take serious. However, I don't agree with the sentence that everyone after this fall or winter will be either vaccinated, recovered, or dead, because that would mean that everyone will get in touch with the virus during this winter. In particular, the development of such an pandemic, of such a spread of a virus, is not that it's just everyone gets contact with the virus, but it's actually going from different social groups to social groups, and that's why we have those natural waves behaving. So while I agree it's a serious situation, we might as well, if we don't get a higher rate of vaccination, we will have next winter and next fall again an increase of infection. Because it sounds like how Jens Spahn is saying right now, this will be all over after the fall and winter, and we have to prepare for long term here and also think about next year.
Okay, well, let's widen our lens now. Austria has announced a sweeping vaccine mandate starting February 1st. Germany's outgoing government has been very skittish when it comes to the idea of mandates, taking into consideration now the harmful toll this virus is taking on this country. Should the taboo around a general vaccine mandate be lifted?
Well, I can understand why people like the advantages of a general vaccine mandate. But there is a few things we need to consider if we think about general vaccine mandate. First of all, we are seeing that we have to keep boosting right now. So we are talking about the third booster, but we do not know how long the vaccine will last, or the protection will last after the third booster. And it might very well be that we have to revaccinate 6 months later again and 6 months later again, so every half a year. So that would mean to have a mandate to get vaccinated every half year for a very long time. In addition, Germany promised, or the politics promised the people not to have a vaccine mandate. So this will erode a little bit the trust in the government, and I would recommend not to have something like this, where we need to have a lot of trust in the government. And the last point is, if you think about mandates for nurses or physicians, we already have a very complicated situation in Germany. We have too few people working in that area, and it might happen that if they have a vaccine mandate, that they will just leave their jobs. And this is something we cannot afford right now.
So what is the way then out of this emergency? I mean, is it written in stone that there won't be a vaccine mandate? I mean, if this is a crisis of the unvaccinated.
Well, I totally agree that vaccine is the best way forward and that we have to get people vaccinated rather sooner than later. However, with the vaccine, where we don't know the duration of vaccine protection and do not know whether there is going to be new recommendations every few months right now, as we currently have, you cannot have a vaccine mandate. What I think will be really important is to have direct contact to the unvaccinated and ask them why they don't want to get vaccinated and basically explain them more to the vaccine to overcome their skepticism. And I think this is much better working than actually threatening by vaccine mandates or other fees or anything, something similar.
Professor and Director of the Institute of Virology at the University of Bonn, Professor Hendrik Streeck, thank you so much for sharing your expertise with us.
Thank you.